It looks like South Koreans have learned their lesson from their traumatic experience with the 2015 outbreak of Middle East Respiratory Syndrome, or MERS. This trauma has paved the way for many of the successful strategies the Korean government is deploying this time around in the fight against COVID-19. So what happened in 2015? On May the 4th that year, a 68-year-old businessman returned to Seoul after a business trip to the Middle East. A week later, feeling extremely unwell and in pain, the man visited several clinics before being admitted with pneumonia to a local hospital. However, as his conditions deteriorated, he was transferred to the main hospital in Seoul, Samsung Medical Center. When he was finally diagnosed with MERS on May the 20th, it was already too late to stop the outbreak. By that point, he had spread the MERS virus to 28 patients at the clinics and hospitals he had visited. As a result, South Korea suffered the largest outbreak of MERS outside of the Middle East, with a total of 186 confirmed cases. 38 people died and more than 16,000 were quarantined.
Jae-young, the heir apparent to the Samsung business empire, issued a rare apology to the public this morning, as nearly half of all MERS patients came from the conglomerate's hospital.
Back to COVID-19. So just how did the South Koreans manage to bring this pandemic under control? Just 3 weeks after South Korea's coronavirus cases soared to the second highest number in the world, the South Koreans have managed to bring the virus under control. The reported number of new cases on March 16 stood at 76 whilst at its peak. 2 weeks earlier, on February 29, it was 909 new cases. As a result, the mood in South Korea is drastically different to the sense of panic and confusion in Europe and the US, where the arrival of the pandemic at their doorstep has come as a surprise to many. So how did the South Koreans do it without the need to lock down the entire cities or taking some of the other authoritarian measures that had helped China? The same questions have been posed to the South Korean Foreign Minister Kang Kyung-wha on BBC's Andrew Marr show.
Thank you. You have adopted a particular strategy towards this. Just explain to us the basis of your strategy.
Yes. Well, the basic principle is openness, transparency, and fully keeping the public informed. And I think this is paying off.
Well, this is largely down to a combination of transparency and openness using the latest technology and a responsible, immediate approach by institutions and citizens. Openness, transparency, and fully informed using the latest technology. The Korea Centers for Disease Control and Prevention, KCDC, has been publishing detailed information on the disease at the same time every day. This valuable and important data has helped health experts, scientists, and citizens alike to improve their own understanding of how the coronavirus functions with each passing day and allaying many fears they might have had. This openness is also apparent when the government has been using the National Mobile Phone Alert System to warn residents when a fresh case is detected in the area and provides detailed information about the last few places the patient had been. As a result, this alerts people who have been to these locations to monitor and report possible symptoms.
You've also got the most extraordinary testing system. You're testing, I think, 20,000 people a day,
Yes.
which is far more than any other country of your size. How have you managed to achieve this, and why is testing central to what you're doing?
Well, first of all, testing is central because that leads to early detection. It minimizes further spread, and it quickly treats those found with the virus. And I think that's the key behind our very low fatality rate as well.
Testing, 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 and quick response. South Korea has been conducting around 12,000 to 15,000 tests every day and has the capacity to do 20,000 daily. More people per capita than anywhere else in the world. Roughly 307,000 tests has been carried out as of March 19. This allows early detection and treatment and to minimize the spread of the virus. They even have drive-through testing facilities where officials in white hazmat suits can be seen leaning into cars to take fluid samples from the driver and passengers. The test results are quickly shipped off to a nearby laboratory where staff are working 24 hours a day to process results and are returned in a matter of hours, which then helps reduce crowding and contamination exposure at hospitals. South Korea has created a network of 96 public and private laboratories to test for coronavirus. Comparing the Koreans' approach with the UK, where, as of March 20, the UK had only tested 64,621, which is significantly lower than the level needed to truly track the extent of the outbreak. When the Chinese first released the virus genetic sequence in January, a number of South Korean pharmaceutical companies immediately started to develop and stockpile test kits with the help of the government, well ahead of the country's first outbreak.
The other thing that you do, of course, is that you monitor people afterwards. You're not going into the same kind of lockdown, the social exclusion that a lot of European countries are, but instead you're monitoring people by phone app. Again, can you explain why you're doing that and not closing down large chunks of your country?
Well, I think this is being faithful to the values of our very vibrant democracy, which is open and the government fully in the service of the people. And I have to say, our public is very demanding and expects the highest standards from government services. And I think this is the key, the drive of our response to this. We are monitoring very closely the inbound traffic. We have also put in place vetting of outbound traffic so that we minimize the risk coming in from the inbound traffic, but also make sure that we do our very best to contain the spread within country, but also taking steps to vet those with possible symptoms among those who are leaving the country.
Constant monitoring using latest technology. The South Korean government created a mobile application that monitors those already under quarantine and sets off an alarm if they venture outdoors. Visitors into the country are also being asked to record their symptoms on the app. Compared to many European countries like Spain and Italy, South Korea also managed to control its outbreak without locking down cities or banning travel. In fact, the term social distancing first originated with the South Korean president's campaign against the virus. However, this doesn't indicate other countries should and could follow suit. South Korea's early testing with the masses and early detection may have afforded it the luxury of being able to avoid declaring a total shutdown. The world needs to learn from the South Koreans, who are happy to share their approach in fighting against this virus. After all, this is the time when the world needs to come together to fight this pandemic.